Hello and welcome to another episode of Research That Matters. This is a weekly post that we're trying to put out that discusses what the research says about topics that matter to you. I am Dr. Chris Freitag with Lavaca County Chiropractic in Hallettsville, Texas. So today we want to talk about pregnancy. Pregnancy is certainly a special time in every couple's life. Having a baby is an emotional roller coaster. Joy, happiness, anticipation, fear, excitement are all part of the process. But the process of how an expecting mother's body changes over the course of that pregnancy is a completely different story. Over 90% of women, these changes result in low back pain. And over half of women with back pain during pregnancy will actually continue to have back pain after the pregnancy. So it's a huge deal. Those percentages are huge. 90% of women having pregnancy that are pregnant are likely going to deal with back pain, and half of those are likely going to continue to have back pain afterwards. So it's a huge problem. Chiropractic care, though, has been shown to be one of the safest and most effective ways to help relieve pregnancy-related back pain, both during and then after the pregnancy. So having a chiropractor on your prenatal team will absolutely help you stay active and help you maintain that high quality of life throughout your pregnancy. I certainly get asked all the time from patients and individuals that run into me as to whether or not they can even receive chiropractic care when they're pregnant. Sometimes we'll have patients who we're currently seeing, and then all of a sudden they find out that they're pregnant and they wonder, can I continue with treatment, or what can or can't we do? And the answer is yes, absolutely. People can definitely receive chiropractic care all the way through their pregnancy. It's absolutely safe. There's certainly modifications that we adjust to and that we make to help deal and work around the belly, certainly as it grows, but all the way up until delivery day, we can work with any individual who is pregnant. So here's a few key points to kind of highlight with this problem with back pain and pregnancy. So the extra weight that comes in the abdominal area as part of the pregnancy, it places an increased stress on the joints of the low back. And this stress, which most commonly creates what's called a hyperlordosis, which means there's an increased curvature within the back because the weight of the belly is pulling the back forward. That leads to this pregnancy-related back pain. It's one of the common causes. In a recent study, and here's our research highlight, that's what I tried to bring forward here for you. Research highlight is a study that was done in 2012 from the American Journal of Obstetrics and Gynecology. All right, so this wasn't even a chiropractic journal. This was an OB-GYN journal that showed chiropractic care both reduces pain and improves the quality of life for mothers suffering from pregnancy-related low back pain. So what the study did is it took two groups of people, of women that were pregnant. It started following them in either their 24th or their 28th, somewhere between their 24th and 28th week of the pregnancy. If you had back pain and you were in that stage, you were essentially included in the study. Half of the women received chiropractic care then for 4 to 6 weeks up to the 33rd week of pregnancy. So depending on when they started, either somewhere between their 24th and 28th week, then once they got to 33 weeks, they were re-evaluated. Both certainly the group that didn't have chiropractic care, that continued to receive their basic obstetric care and the basic recommendations that they would normally get for trying to deal with back pain that your OB-GYN would give you. And then the other group received the chiropractic care along with their standard OB-GYN care. And what they found was significant improvement in the group that received chiropractic care along with them. So, huge improvement it needs to be utilized, and people need to know it because it affects the quality of life for so many people. So you, right now, watching this, need to tag someone that you know who is expecting, that could utilize the services of chiropractic care to make sure that they have as happy of a pregnancy and joyful of a pregnancy as they can. Because you'll be surprised at how many women, how many people in general don't know that chiropractic care can help them through their pregnancy. So, thank you for joining me again today, taking time out of your day to watch this, get some information. I hope it was helpful. Click the share button, pass this on to your friends, your family, certainly your friends and family that are currently pregnant. Pregnancy brings enough stress and discomfort to expecting mothers without having to deal with additional back pain. So if that's one aspect of the stress that we can eliminate from someone who's expecting, it helps their quality of life so much. So take a moment to like our Facebook page now so you can continue to receive updates on the recent... Hey, I think we're back on. Jeez, I had a recent pause. Somehow notifications on your phone pop up and pause your video. That wasn't too cool. But anyway, just closing up, thanking you again for joining me. Click like on our Facebook page so you get the updates from the latest research that matters. Again, I am Dr. Chris Freitag with Lavaca County Chiropractic in Hallettsville, Texas. Look forward to seeing you again next week. Have a great day.